What is scabies? Today we are going to look at scabies, its introduction, what causes scabies, mode of transmission of scabies, signs and symptoms, and we'll be looking at the signs and symptoms depending on the types of scabies. From there, we are going to look at positions in which these rashes are found on the body or the mode of distribution. Then we are going to look at its diagnosis, treatment, and prevention. So to start with, what is scabies? Scabies is a contagious skin condition due to the infection by a mite of the species Sarcoptes scabiei. It is mostly found in tropical areas and is widely spread within crowded places. What is its mode of transmission? Scabies can be transmitted through skin-to-skin contact. For direct skin-to-skin contact for a prolonged period of time. That simply means that it is not simply me getting in contact with somebody, but me getting in contact with that person for a long period of time. As well as it can be transmitted through an exchange of dresses. It means that in a house where you take dresses from one person to another and you wear them, you can easily have scabies. Scabies can as well be transmitted through linen, bed sheets, blankets, pillows. It can equally be transmitted through furniture in the house because it can live on this object for at least 1 to 5 days before it dies off. And probably before it does so, it has laid eggs that is capable of moving on and hatching and infecting other members of the house. Scabies at some point in time can equally be transmitted through sexual intercourse because you are going to get to skin contact with that individual for a prolonged period of time. Now we'll go to the signs and symptoms. Before we talk about the signs and symptoms of scabies, we will look at the two main types. I say the two main types because there are other types, but these are the two main types. There are two main types. One, the classic scabies and the crusade scabies. The classic scabies, how does it present itself? This is the scabies where you have rashes as well as you have itching. To us here, we call it scratching. The scratching that you have does not just have an end, and it gets worse in the night. Gives you sleeplessness. You cannot have peace when it comes to this. And these scabies, the mode of distribution, where this classic mode of scabies distribute itself on the body and on the positions that we have folds, mostly on positions that we have folds, which we could be talking about. One, the individual will have rashes on the scalp, mostly for babies, as well as under the armpit, in the corners of your hand. At these positions, we talk about the waist, we'll talk about under the breast, we'll talk about the genital area, and it gets worse on the area of the buttocks and the thighs. We equally find the rashes on the knees as well as the ankle. These are the positions that you find these rashes, and they always move in line. So it appears as though it is drawing a line. This simply tells you that there is a mite under it, and this mite cannot be seen with the naked eyes. Now, for the crusade or the Norwegian scabies, it is easily seen just on the corners of the hands as well as on the feet and on the scalp of the head. These are the three positions where the Norwegian scabies can be found. where their own symptoms or their mode of distribution on the body is mostly populated. And the Norwegian scabies, the scabies rate here is very high. The scabies burden is very high. That simply means that for somebody that is having a classic scabies and for someone that's having a Norwegian scabies, it's like the percentage of scabies for somebody with a classic scabies is 2 on 10. And while this a percentage of scabies with somebody with a Norwegian scabies is like 9 on 10. And the distribution mode for somebody that is having the Norwegian scabies, we talk about furniture's linens, because here immediately the individual touches surfaces or dresses or linens, they leave a high rate of those eggs and the scabies itself on these surfaces and makes them a good mode of transmission for others. And the individuals that mostly have these Norwegian scabies are people who are immune suppressed. Here we'll be talking about HIV patients, we'll be talking about patients that are suffering from TB, we'll be talking about patients that are suffering from cancer, especially the leukemias, and worst, we'll be talking about old people. So these are the class of people that mostly have the Norwegian scabies. But for the classic scabies, anyone and everyone can have it. And just to make you understand that scabies has nothing to do with the hygienic nature of someone. It's a disease condition that can be transmitted to whether or not you are clean or you are dirty. Because we remember I said it is mostly found in tropical areas as well as in crowded areas. So we'll go now to the diagnosis. How can this disease be diagnosed? Now, for scabies, it can be diagnosed by taking a piece from the person's skin for the positions that are having the rashes and examining it through the microscope. Under the microscope, when magnified, you are going to be able to see the mite or the eggs. But mostly, scabies can be diagnosed clinically by having the signs and symptoms and the history from the individual. Because somebody that is suffering from scabies, I tell you, it cannot just go away. Like other disease conditions that you said, okay, we'll just be there for some time and you'll go away. Scabies do not go away like that. It has to be treated for it to go away. It has to be under the procedure. You must take the different steps for your treatment, because your treatment does not just lie with you taking medications or taking lotions or applying lotions on your body. It equally involves you systematically cleaning your house, your linens, to make sure that you are free from eggs as well as the scabies mite. The history, the individual have rashes that are found on specific positions of the body, as well as the pattern in which the rashes appears, the severity of its itching, and the period of time in which this itches occurs. When it gets worse, especially in the night, will tell you as a healthcare personnel that this individual is suffering from scabies. Will tell you as a patient or an individual that what you are suffering from is scabies. I am saying so because there are many families that suffer from scabies and there is nothing anyone can do about it. There are many families that have taken treatment upon treatment upon treatment, and there is no one that is capable of understanding what these individuals are suffering from and how they can help them. There are people that have gone to the hospital and spent a lot of money, and yet they are unable to solve this situation. And it's everyone in that household suffers from it. So if you're having rashes and they're itching, and only you as an individual have it in a house of 8 or 5 or 4 persons, then it is not scabies. When one person in that household has scabies, Everyone is liable to have it. The mode of transmission, it takes a period of time. It takes from 3 to 6 weeks for the disease condition, for the rashes to start appearing on your body after you are contaminated with it. So as one person has it, every other person in the house has it. So it will be like you are coming to the hospital as an individual, and the doctor will simply ask you, how many persons are in the house? You say, we are 4 of us. Or how many people are in the house? We are 4 of us. Okay, you guys are 4. Is there any other person in the house that suffer from that same disease condition? You said yes, all of us. That simply makes it scabies. So these scabies can simply be diagnosed clinically by getting the history and the signs and symptoms of that individual. Now we should go to treatment. Treating scabies is one of the complications of this disease because it can be difficult. There are people who has taken the therapy 2, 3 times, 4 sessions, and yet they still get reinfected. And you're like, it's not working. You're like, no, this might not be the disease condition, but they might have misdiagnosed me because they cannot be giving me different treatment, and I'm not getting any better. The household keep being, the family suffers from the disease condition without any relief. But I want to tell you, worry not. I'm here to take care of that. When we talk of scabies, there are people that have taken one. There are people that have taken one, the permethrin cream. It is applied topically. There are people that have taken this treatment for 2 to 3 to 4 sessions, and yet the scabies says, I go nowhere. They do not have any relief. It feels better now, and after 2 to 3 weeks, it comes back as if it never went anywhere. If you have gained resistance for this particular permethrin, if you have gained resistance for permethrin, and you have struggled with it, and you've taken all that treatment and nothing happens, I will be recommending you to work with the Terminator. Yes, because this lotion has been tested, has been proven effective for everybody without any restriction. Except for one thing, do not apply it on your face or the mucous area close to the genitals or close to your anus. If you're a breastfeeding mother, do not apply it close to your nipple. This is known as, now the terminator of this disease condition, the terminator of scabies, is known as the ACARILBIAL lotion. The ACARILBIAL lotion is the one lotion I have given it to many of my patients. I have given it to many of my patients, and none has come back to say it did not work. All of them has given a perfect and a conclusive 5-star for this treatment. The ACARILBIAL lotion is the best for scabies. Go to any pharmacy at all, and request that you want to buy the ACARILBIAL lotion. How is this lotion used? That becomes one of the very important aspects. Now, this lotion is applied on the body, and it has to be for a period of 24 hours before you wash it off. So when you get the medication, first off, if you are a single individual, you will use half of the container. It's a very small bottle of this nature. If you are a single individual in the house, you use half of the container. If you are 2, you buy 1. If you are 4, you buy 2. And if you are 6, you buy 3. The whole family should use that medication at the same time. That is to say, if you are two in the house and you get one of this lotion, if you choose to use in the evening, which I always advise that you should use it in the evening, you heat water or you use hot water to have a shower for like 8 to 10 minutes. You dry yourself. Do not apply any other lotion on you. Now take the ACARILBIAL lotion and apply on your body from your neck. Do not apply it on your face. For children or old people that have it on their scalp, apply it on their scalp and make sure it does not go on their face. Apply it on your whole body and give yourself some seconds for it to dry off. When it dries off, repeat the process again. So that is 2 times. You apply the first time, you allow it to dry off, and then you repeat the process the second time. When it dries off, you wear your dress and you can go to bed. The next day in the evening, you repeat the process again. The third day, you repeat the process again. So this will be for 3 days in that week. So if I apply it on Monday, I'll apply Monday evening, Tuesday evening, and Wednesday evening, and I will stop. The next week, I will start again on Monday in the evening, on Tuesday in the evening, and on Wednesday in the evening. And that will be all. Because by the next week when you're coming to apply it again, you have no more itches, but the rashes might still be visible. Your rashes might not fade away, but the itching will die off. So the next week you apply it again and you observe for that week. If the rashes goes away, you are good to go. Now every member of the household has to start that treatment together as well as finish it together. So if you are supposed to use 2 bottles as 4 individuals in the household, please make sure that you use the 2 bottles till it is finished. If you are a single individual in the house and you want to use half of that bottle, please estimate it and make sure it gets to half before you stop. When you have finished this treatment, I assure you, on your body as an individual, scabies are far gone. You have killed everything on you, and you will be good to go within the second week. Now, to come to the prevention. But before that, while taking your treatment, you can take any antihistamines. But I tell you, with this treatment, you do not need any antihistamines, because by the 3rd day you apply for the very first week, you will not have any more itches. But we will need to go to the prevention where we're talking about cleaning the house, cleaning your linens, sun drying your blankets, as well as your clothing. To start with the clothing, all the dresses you have worn within that time period that you started observing that you have rashes on you should be washed with hot water. So you wash your dresses with detergents, and then you boil some water and you pour it in them for some time. You sun dry the dresses and you iron the dresses. This is going to help to kill every egg or mite that is found on your dresses. For the dresses you've already washed before, please put them in a nylon and tie and allow them for 7 days. 7 to 10 days, because those mites are capable of surviving on clothing, on furniture for at least 1 to 5 days. So allow them for 7 to 10 days, making sure that they are all suffocated and they die. For your linens, please wash them. For the blanket, wash it the same way. For your pillow and your bed sheet, or your pillow and your mattress, send it out every morning for the sun to heat on it. For your furniture in the house, like the chairs, please clean them with detergents. And this will be the end of it. I know many families suffer from this, and I know some people have taken medication over and over and over again. But I just want you to try this. If my patients have testified, it will be your own testimony I will be waiting for. Just have some faith and know that this is going to be the bus stop of your family suffering from scratching. It's not come no go. This one is another level of come no go. So please save yourself and save somebody else. Share the video. Is the video not nice, Papa? Is it not nice? Share the video. If you're just seeing my video for your very first time, I want to say welcome. Please sit on the first bench on the comment section. Like the video, subscribe, turn on the notification bell so that each time I post any of my videos, you will be the first to be notified. If you are my returning subscriber, I want to say thank you. I wish that as you come back, may you be able to learn something unique, something that is life-changing, something that will help you, will help your brother, will help your sister in one way or the other. Please, take some time. Don't just keep this material to yourself. It's too good to be just for your ears. Share it. Send it to your friend. Send it to your brother. Send it to your sister. Because you do not know what these dresses are covering. Someone might just be somewhere and is needing this information to save their life. I wish you the best. Live healthy, live happy, and live in peace. There is nothing, there is no power of healing as much as you living happy, in peace, and in love. Ciao.